Hello, good afternoon. Thank you for joining us. My name is Christopher. I lead accessibility and disability innovation for Google for EMEA, which means my focus is Africa, Middle East, and Europe. Our goal is to try to understand the opportunities of technology, how it can help people with disabilities across the region, across the world. And my work here and the work we're here to talk about together is one of the first research things that I started off when coming here. We began this work 2 years ago because we launched the work into this idea of mobile as AT, trying to understand what can mobile devices do for people with disabilities. We had this idea that, or rather we realized no one's proven that it actually has an impact. Everyone believed there's truth to it, but we spent the past 2 years coming up with the idea, coming up with the implications, and doing the research to understand what does it actually mean. We did the studies in 3 different countries, but I won't go into these details because Kathy and Pascal are much more eloquent than I am. I was just the troublemaker who asked a question, and I'm really honored to work with these people. They are kind, intelligent, driven people, and we're trying to create an opportunity that helps people live their lives in the world that wasn't designed with us in mind. Opportunities to improve education, opportunities include relationships and life in general. So with that, Pascal, would you introduce yourself and then share your thoughts?
Thank you, Chris. Good afternoon, everyone. It's great to see you all here. And as Chris mentioned, we were here, not exactly here, further down the road 2 years ago to launch this piece of work. So it's great to be back now at this stage. I'm Pascal Berfeld, and I head up ATscale, the global partnership for assistive technology. This covers a wide range of different types of devices and services, but digital devices and smartphones is very, very important among them. In fact, as you all know, mobile phones have really evolved a lot over the last couple of years, moving way beyond just simple communication devices. And in fact, today they can replace a lot of standalone assistive technology, like magnifiers, like text readers, like voice assistants, navigational aids. And there are countless life-changing applications that are now developed that can serve as AT as well on a smartphone or a tablet platform. So despite this huge potential, we really realized that access to this AT remained a problem. There's still a big gap in the digital divide for persons with disabilities. But also, and this is really where we're coming from ATscale, there was a systemic issue and challenge in that governments and organizations that are involved and responsible in this space were not considering mobile phones or smartphones as assistive technology. They saw them as, luxury goods or something everybody has now. And why would we treat it differently? And this is where one of the reasons why this idea of we need to build more evidence as to why it's so important and how life-changing smartphones can be for people with visual and hearing impairment in particular. That's the 2 domain areas that we focused on. And so it was fantastic to partner with Google and GDI Hub to jointly fund and guide this piece of research, and very happy that it's now come to a point where we're going to hear from Kathy what's come out of it, but also some thinking has been done in terms of, okay, so what? Okay, this clearly you'll hear a positive outcome of this research, but we really want it now to have impact and to change things, right? And so that'll be what comes next. Coming up, and we have actually a document, I think there'll be a link that'll show where we have developed some recommendations targeting different stakeholder groups, governments, private companies, academia, NGOs, et cetera, et cetera. So hopefully this will take on a new life going forward. So with that, I'm sure you're all very impatient to hear the results of this study that was done across India, Kenya, and Brazil. Kathy.
Thank you, Pascal. I'm probably going to stand up so I can see my own slides, if that's all right. So how's everyone? Good? We will apologise as well that you can see that we're three white people presenting some global research. Our local partner, the project manager left, and I think the person who'd just taken over wasn't feeling like they wanted to be up here with us. But we've been working with a lot of people on the ground, both university partners and local disabled persons organisations or OPDs. And the idea was to try, as Pascal was saying, to get research and evidence around the value of a mobile phone. And from, I think, Google's perspective, the reason this was an exciting project is you could begin to understand where there may be still ways in which Android could be improved or a mobile phone experience could be improved. From Pascal's and ATscale's point of view, they're really interested in changing government and changing funding at a strategic level. And from my point of view, I'm a professor and an academic, but I'm also one of the co-PIs of AT 2030, which is funded by UK International Development, and they care about research and evidence. So what is actually, in the terms of supporting disabled people in development and countries in development, what is the research and evidence, which is why I think it's a nice gang to be working with, one of my favourite projects. So, as you can see, we've got lots of partners, lots of them, and they're all brilliant, and I'd just like to take a moment to thank them all. So we worked with 8 blind and partially sighted people, or deaf and hard of hearing people in 3 different countries.
800.
800.
100, not just 8.
What did I say?
8.
Yeah, I'm dyslexic, I read things differently. 800 people, and then 6 months. So what we've done here is focused in on Kenya, because that's where we are. Mariam, if you'd like to wave, Mariam. Mariam's halfway down the room on the left as you're walking into the room. Mariam can tell you a lot more about this research because she's led the research on the ground. So, what did we do? Well, we gave people phones. That was the first thing. Hilariously, we had to work quite hard to make sure people got fully accessible phones, because our first phone that we'd picked we thought was fully accessible, but it turned out that the manufacturer had stripped out the accessibility features for visually impaired people, and Christopher's been working hard on rectifying that. So we went back to the big boys, Samsung Galaxy A14 smartphones. We gave people 2 gigabytes of data a month for 6 months. We included digital skills training, 5 modules of that, and some ongoing support from local ODPs and universities. And the result of the overall program, the headline really is that we've managed to deliver a low-cost, high-impact model that made ordinary smartphones powerful assistive technologies. So just to pull out a couple of examples, the M-Pesa app here was one of the most widely used apps. So especially visually impaired participants were, unfortunately, those 60% less likely to use the payment app than hearing impaired users. And why do we think that is?
Because it's not accessible.
Because it's not accessible. Not because they haven't got money, not because they don't want to bank, but because the tool has been developed without them in mind. So if we move on, we also, the biggest thing was internet connectivity. There have been studies previously that have looked at the value of mobile phones, but we were particularly interested in internet connectivity and digital skills training in this project. And so we started trying to figure out who were most at risk of things. As the project evolved, we got very interested in why were some people finding life really difficult, even though they'd been given this mobile phone and they started off really well and everything was going really well. And the reason was they were running out of data. So then we wanted to know, well, why are you running out of data? So we measured, first of all, we developed a measure, which I find really difficult to say, but it's a severe data precarity. So it's basically if you run out of 2 gigabytes within a week, so it's meant to last you a month, but you run out of that amount of data in a week, and you report high levels of disruption to your life because of that running out. And so we found that 32% of all participants experienced severe data precarity. And blind and low vision people were 2 times more likely to face it. Wi-Fi access reduced risk by 50%, but it didn't eliminate it. We had people saying things like they were talking so brilliantly and how excited and everything was wonderful, and then without data, I can't read, I can't move, I can't talk to anyone. So they were having 1 week a month of everything going really well, and then 3 weeks where everything disappeared. So it's not a behavior problem. I heard immediately from people, well, they're maybe just wasting the data. I don't know why everyone always wants to blame the user, but apparently people who run systems often do want to blame the user. So, however, 73% of people were reporting different strategies of ways they were trying to conserve their data. They were desperately trying to conserve data, but it didn't actually prevent against this exhaustion and its impact. So it's actually the structural barriers, not their user choices, that are driving this digital exclusion. So I'll just finish on this last graph. On the left-hand side of here, we've got 0 risk factors. So the risk factors are if on the left-hand side, you've got no risk factors. The top icon means you live in a city, the second icon means you're hearing impaired, third icon means you're male, and the fourth icon means you've got Wi-Fi. So you're a man who's deaf or hard of hearing, living in a city with plenty of access to Wi-Fi. You've pretty much got a 6% chance of running out of data. If you move towards the right, when you've got these icons, which are meant to show, it's my best icon I could find of a village that didn't look too Western. But that's a village, you're visually impaired, you're female, and you've got no Wi-Fi. At that point, you are 3 times more likely, up to 60% more likely to lose your data. So between those two bits, from 6% to about 50%, you've got 8 times more likely, if you're blind and partially sighted, to not be able to access or use your mobile phone. This leads to loads of policy recommendations that we could go into. So I'm not even looking at this slide just yet, which sums up, but not to give away some things which are in the document, which you'll be able to see in a minute, you'll be able to download and look at. But obviously, if we could set up Wi-Fi hubs in rural communities, if we can ensure that women are able to access those on equal terms, if we're able to make sure that payment plans for data are actually accessible to visually impaired people and hearing impaired people, then people will be able to use the mobile phone as an essential assistive technology. If we don't do those things, if we leave people without Wi-Fi access, with insufficient data, especially if they're women, they won't be able to access the things that they need. So this is 4 very high-level bullet points to sort of wrap up what we've been speaking about and what Google, ATscale, and ourselves have been trying to, I suppose, evidence so that we can make change. Smartphones can function as essential assistive technology for people with disabilities in Kenya. We've also got the evidence for India and Brazil. Participants reported improved independence, communication, education, employment. I think there's something like 20 academic papers planned on this data. Like there's actually, the more you dig into it, the more interesting it becomes. So you can read more about it in due course. Data depletion, affordability remain major barriers, especially for blind and low vision users and for women. And policy recommendations that we've come up with target MNOs, governments and funders to try and address these structural barriers. Thank you very much.
Thank you, Kathy. So wrapping up, one thing I want to share, a lot of people are talking about AI, and AI is a very powerful tool, but there's a balance of whether you can do AI on your device or whether you have to do it with the cloud, which is why this internet technology is so important. If you have a more powerful phone, you can run these models on your device. If you have a less powerful phone, you need to have connectivity to these cloud models, which is why this connectivity is so important. Many of these most powerful ATs do require either a powerful device or access to the internet. So as policymakers or as companies put forth these plans for people with disabilities, realize that these new tools that are so meaningful either need a stronger phone or more powerful phone, or you need access to the internet. One last thing, and then we'll move off to questions, is Kathy brought up something really interesting when we first got started. When we did the kickoff, our plan was to train the trainers using a phone from a carrier I'm not going to name and shame at this point. But what we learned is it's very easy for a manufacturer to make a phone not accessible. So the Android that Google releases is inherently highly accessible, but if someone were to add a layer of software to make it all look the same, if you don't go through the effort of making that accessible as well, you can destroy screen reader access. And we literally just realized that the day we were doing the training. So I had to jump into Harrison's Prius, go to the Samsung store, buy 5 devices and bring them back to run the training. So you can't just assume because it's Android, it's accessible. And that's why this work is so important. So we are trying to create a taxonomy of what does it mean to be accessible? What are accessible phones? What features does it have? And for whom does it work? So another outcome of this is we're partnering with GARI and to create a taxonomy of disability when it comes to these features, so someone can know what phone is actually relevant for me. Because if someone says it's an accessible phone, the question you should ask is accessible for whom? Because everyone's needs are different. So this research is going to create more and more goodness. I'm super proud of having been a part of this. We have about 10 minutes for questions, so I'm happy to walk around with a microphone. And if you have any questions, now is your time. Anything?
Hi there, thank you. Hello, it's Mark from MobilityNet. Hello. I just wondered if there was any deeper information about what was depleting people's data. You've implied here it's something to do with being blind and low vision, but you may have skated over it. But is there something in particular that makes that data run out so quickly for some users and not for others?
Yeah, I think there's a lot of usage of basically the basic accessibility features, but they're using them constantly. So they're using navigation apps constantly. They're using VoiceOver constantly. They're using Lookout frequently. So it's just I mean, Mariam will probably know the exact breakdowns of the apps that we use because we did track each and every one of them. But it is just that once you get used to it, so the question, actually, the thing that Pascal lent over to me to say was, you didn't mention the digital skills training. I skimmed over that as well. It's quite a big project, so I had skimmed over a lot. And there was a lot of work done on the digital skills training, but we realized that even with we got stuff from Google, we enhanced it with stuff we knew from UCL. We worked with local partners to make it locally accessible, and still people needed a lot more. The WhatsApp groups were so active to help each other, and people were just reaching out going, Lookup's amazing, look, you can do this, you can do that, you can do this, and then people were getting excited about applying for jobs, about using it for education, and so suddenly they skyrocketed the data. I can provide the full breakdown for you.
But for the record, TalkBack and Lookout normally don't require internet access.
No.
Yeah, so it's probably more so it'd be a really interesting thing for us to dive in to see where it is.
You can see that I am really the high-level person on this grant.
Next question is over here.
Who doesn't have an Android phone?
Oh, I'm sorry. Yeah.
Thank you very much for the wonderful presentation. This is Haruna speaking. So my question is basically about data depletion, and you mentioned it. So we are observing the rate of data depletion when you give that 2 gigabyte data. And so I just wanted to follow up. What did you find out about the consumption? Or is there any kind of setting that took this kind of data? Because you mentioned that data depletion within like a week. And some other participants also reported, depletion within less than a week. So what was that kind of, the causes of that data completion? Because personally, I've also experienced the same thing, but we have failed to get a very conclusive answer from this internet service provider. You buy data for a month, but within 2 days, it depletes. And we have no answer what takes that data. So many of the internet users kind of presume that maybe it's this kind of fishy activities going on. So which enriches this internet service provider that makes us buy more data that depletes within less than a week. So basically on your research, what did you find out about what really consume this kind of data at that very fast rate? Thank you very much.
Can I clarify the question? Is the question, what did people use the data for? Is that the short version?
My question was basically to ask you, what did you find out about this data depletion? What do participants do to make that their data deplete so fast? I want to understand how can I be able to save my data. For example, maybe it can be like a setting on my phone that takes data or something else.
So why does the data deplete so quickly? And generally, it's just usage. I mean, Mariam, jump in if you'd like, if you've got some specific examples.
One moment.
Thank you. So a lot of blind and partially sighted people said that they were using, as Kathy said, Google Maps for navigation. One of the things that people were able to do using the phones and after receiving digital skills training was they were able to use their phones to do more things independently, which meant that they were going out more, they were talking to people more, and they were using their phone as assistive technology to do all of these activities, which meant that they were using the data more as well. People also said that where they had access to Wi-Fi, so for example, in schools, offices, shopping centers, etc., they would always connect to a public Wi-Fi to conserve their mobile data. But even then, they were, just using the phones more as assistive technology, but also in general to keep in touch with friends and family. I agree with Chris that TalkBack and Lookout doesn't use mobile data, and that didn't come out quite as clearly from the research, but people were using apps like Be My Eyes. And those of you who don't know, Be My Eyes is an app which connects a blind or partially sighted user to a sighted volunteer who guides them through whatever they need help with through a video call. And that takes a lot of data, obviously. Similarly, people were using WhatsApp video calls more, especially deaf and hard of hearing people, because using the phones, they were able to communicate with their peers in Kenyan Sign Language, which they weren't able to do before. So it's just increased usage, increased independence in using the phones as assistive technology, whereas the dependence was more on humans before. So, yeah.
Thank you. David?
Yeah, I mean, when you said about data depletion, I could only think of two things that would cause that level. One was very high usage of video, and the second is whether or not they were using the connection to update apps on demand. So if you're using your data to update the apps, you could go through hundreds of megabytes in an afternoon whilst your apps are depleted. So I think there's some things there in terms of policy about saying that you only update apps on Wi-Fi would make a big difference to some of that data. But I had two other points I wanted to mention. The first is there any appetite to expand the research to consider a wider range of consumer technologies? Smartphones have been with us for a very long time. Wearables and smart speakers and so on are often at a lower cost than a mobile phone, but have a number of features that people might want to use. So that would be one. Have you considered putting in a recommendation that the manufacturers of assistive technology that demand data, that some form of ranking, in the same way as we do with energy, indicates the amount of data you would require to use this on a regular basis? So for instance, on our home electronics, it gives us A to G for its energy rating. Could we give it a data rating so that the purchaser knows this is going to use a lot of data if I want to use it a lot?
Thank you, David. Just on your question around follow-on from this work, indeed, we had begun conversations around how do we, take this to the next level, maybe look at other types of devices, other population groups, maybe dive deeper in certain areas, and that was actually in our plan, and but it's one of those things that have been impacted by the cuts in aid and development, and so we've had to put that on hold for now until we find the resources. But I do think there's a big merit in pushing this much further. And the other thing that we want to do much more of now, which has also been slightly impacted by this funding crunch, is the, taking the policy recommendations and looking at the whole financing. So we've just heard about the data issues. How can we come up with models that would make it more financially accessible for persons with disabilities to access data or more data? And that requires working with the telcos. It requires maybe working with micro-lending institutions. It may require other kinds of solutions. But that needs further exploration and so forth, because that is one of the big barriers now to really, truly making these smartphones assistive technology day to day.
And there are also other technologies like zero rating certain applications if you prove that you have a disability. So there are different ways to make these critical applications more affordable to use for some people. But your point about updating on Wi-Fi applications is something that didn't occur to me until you mentioned this. So if we do more of this kind of research, we should make sure that certainly happens, because that could be a very obvious hole that we can plug. And it has nothing to do with disability, it has to do with just understanding how to use the device. So folks, we're at time. Thank you very much for your questions. Thank you much for your attention. We're going to be stepping outside to let the next group come in here. If you have any questions for us, we'll just be outside the door. Thank you all very much, and thank you to my dear friends.